hip dysplasia is when your hip joints don't develop properly. Elin has so far had 4 surgeries to do with her hips. This kind of rotation is very often a warning sign. Hey girl, I know you don't want to lie on your back. So what are some signs that parents might see at home that are indicators that their child is having hip dysplasia? Now, this would be clearer if Elin was in leggings, but I think if I was to try and change trousers on her right now, she would have a right go at me. You can tell she's not happy lying on her back. But can you see how this leg, her left leg, is lying quite straight, but she's favoring her right and the leg is rotated in. This is the leg that is dislocated. And I can actually feel, if I put my hands on either side of her hips, I can feel where the joint is out here. This kind of rotation, particularly rotation inward of the leg, is very often a warning sign. And you can see it when lying down. You will also find that when you're moving the legs, can I have this leg? Thank you. When you're moving the legs to do a pad change, one leg opens up easier than the other. And there, could you see that she jumped? That is a pain signal. And I'm gonna get her out of this position because she's not happy with me. There, let's get another cushion behind you. There you go. Do you feel supported? Can I get you some paracetamol? Can you have paracetamol? No, not yet actually. We're gonna have to wait. It's been 4 hours. Give it another hour before paracetamol unless you really tell me off, okay? Poor girl. You might also see an imbalance or unevenness in the way that they sit. Now, the way Elin is sitting right now is that she's got my leg underneath her legs to help position her, and I've also put her knee pad from her sleep system between her knees. But when she sits in the wheelchair, she will very often start to lean over on her right side because that hip is not supporting her as well as it should do. And the same if she's in a postural support seat. So that is an early sign that you can see as a parent. Another thing is an unevenness in how long the legs are. Now, Elin's legs are different anyway, because of the hip surgeries that she's had. So her left leg is shorter than her right, because they had to cut off more of her femur in order to reconstruct that joint because it was so bad when we did it. But on a child that hasn't had hip surgery, if you notice that the legs are different length, that too is a sign of hip dysplasia. And then, as I mentioned earlier, you saw a pain signal from Elin. She jerked and then she started vocalizing and pulling her face. She told me, this hurt, I'm not happy. And she's still not very happy with me. You can see her little T-Rex arms, I call them. That's very un-PC. I'm sorry if I offend anybody about that. I'm sorry. We make a joke about it. We call her a little T-Rex. She thinks it's funny. Well, right now she doesn't think anything is funny, but when she's in a good mood, she thinks it's funny. Oh, that is very expressive. She's taking the piss out of me, people. Can you hear her? Exactly that. If your child... I mean, it's hard when you have a non-verbal child who's screaming and you're like, why are you screaming? Is something hurting? If so, what is it that's hurting? Are you hungry? Are you tired? Are you just in a mood? I don't know. All I know is that my eardrums are about to burst. But you know, crying, screaming can be a pain signal, and you know your child best. I can't explain how, and I don't even know if I'm right, but I can look at Elin, her body language and the tone of her scream, and I make a guess as to whether it's a pain signal or a mood signal, because I don't actually know. But I think I know, and she's my child. If you are seeing signs that your child is in pain, you are probably right. It's what I'm trying to say here. Very often as well with hip dysplasia, you may very well find that your child favors a particular side to sleep on if they're a side sleeper, or that their sleep is very broken and they keep waking up in the night crying because, again, they're in pain, right? You're gonna say, hi, I've had a long nap, I feel much better. Yeah, you do, don't you? And if you're wondering why she's got a little mark just above her lip there, I think she's managed to scratch herself in her sleep. But she's all right, aren't you, girl? What is hip dysplasia and why do children like Elin get it? So hip dysplasia is when your hip joints don't develop properly and then they start sliding out of socket. Your hips are displaced, literally. In Elin's case, Elin has quadriplegic cerebral palsy with high tone. So the quadriplegic part of that means that all 4 limbs on her body are affected. She has very little control over the movement of any of her limbs. And the high tone means that her muscles are always very, very stiff. When babies are born, their hip joints are very shallow. But as they start to stand up and as they start to walk, the hip joints get deeper, they develop properly, and the vast majority of babies don't have any problems with this. But because Elin can't walk, she has never really done much of the natural standing up. Yes, we do use a stander and a walker with her, and we have done exercises like it her entire life, but even so, it's nowhere near the amount that an able-bodied child would do. And so her hip joints have always remained very, very shallow. And then if you add the high tone to that, the fact that her muscles are always tense, they are literally pulling her hip joints apart. They're pulling the thigh bone out of the socket of the hip joint. And that's why she has got hip dysplasia and why children like her get hip dysplasia. Now, we knew from very early on that this was a likelihood. We were told by her physiotherapist before she was a year old, I can't remember exactly how old, but we were told by her physiotherapist that because of this not standing up, not weight bearing, hip joints not developing properly, she would be prone to hip dysplasia. So we were expecting it. And also because of that, Elin has been on the early intervention team from day one. I think she was 3 months old when she started having physiotherapy and going to the Child Development Center, the CDC, and also started seeing an occupational therapist and got a specialist pediatrician, all because obviously her brain injuries are so severe. But part of this early intervention and hip surveillance means that she has had yearly hip x-rays from when she was a baby. And so we've been able to see on x-rays when her hips started migrating out of socket. Now this time around, she was due an update with her orthopedic surgeon, and her hip joint migrated out of socket before that appointment happened. And so I requested an x-ray, and this is because there are ways that you can see it as a parent when it's happening, if you know what to look out for. So Elin has so far had 4 surgeries to do with her hips. The first one was a soft tissue release surgery. They basically cut the tendons in her groins to make them looser. And then the second hip surgery was when her left hip had really migrated out of socket. And now that one was bad. So it had, if this is the outside of the hip, so that's the socket part, although Elin's is straighter, and then this is the femur and this is the ball part of the joint. The joint should look like this, but in Elin's case, it was looking like this. But what it did was it rotated and it migrated out, above, and behind her pelvis. So that's how badly dislocated her left hip was. And what they did with that one was what they call a double osteotomy, which basically means a surgical break. They broke her bones, but they do it with a saw, right? So they broke the femur, kadunk, to create a bend. They also broke part of her pelvis, kadunk, to create that socket part of the ball and socket joint. So that's what they did on her left. And it was a really grueling operation. She was on the table for over 6 hours and she was super sick afterwards. Now, on the right hand, the socket wasn't quite as shallow as on the left, but the femur was still very straight. So on the right side, they just did a single osteotomy. They broke her femur and placed it in. It was a much shorter surgery. It was a much quicker recovery time. But what has happened now is that even though they did that, it has now migrated out of socket and it's twisted and it's moved backwards. This is going to be her 5th surgery. This time around, they're going to do the pelvis break to create a deeper socket and then place it back in. I don't know if they're going to break the femur again. The surgeon herself doesn't know as of yet, but just before the surgery happens, they're going to do another x-ray and then she can plan it. The 4th surgery that Elin had just over a year ago was to remove the screws and plates that were in her hip that were keeping the bones together while it was healing. Yes. Hi, gorgeous. Are you in a good mood? I like this. Now, apart from the first one, I have vlogged all of Elin's hip surgeries. You can find them on here and there will be links. I'll put all of them in the description for you so you can see. It's a list, okay? Recovery and healing, it is tough. You know, surgery is really hard on anybody. Going through surgery is a trauma on the body, and when you're putting a child with complex needs through it, you have a lot of difficulties. The second hip surgery, so the one with the double osteotomy, Elin was in hospital for 3 weeks, and 2 of those weeks were spent in intensive care. She was super sick. She'd managed to give herself a really bad case of aspiration pneumonia because she had a massive seizure as a post-anesthetic reaction, and she was on her back because they do what they put the leg in traction, so they have a weight pulling at the leg. This is not funny, Elin. And she had to lie on her back, and she's never safe to have on her back. And so she had a massive big seizure, vomited, and then just inhaled a lot, and she was really sick. So that was bad. The second surgery, she was in hospital. I think it was only 8 nights in total, which is, you know, a third of the time she was in. The third, I get confused with my numbers. I don't really count the soft tissue surgery, and also because I didn't vlog that. Her right hip surgery, she was in hospital for 8 nights. I can't remember off the top of my head how long you were in after we removed the metal work, but I think it was less than a week. And I think as she gets older and as the surgeons are getting better at managing her post-anesthetic reactions, her recovery times get better and better. But you are in hospital for quite some time, and you have to be very careful for quite some time. You may also have heard of Spica casts. That is when they put plaster cast from the hip and down with a big bar between the knees, holding the legs out. She did have that when she had the soft tissue release, but she didn't actually have it for any of the other surgeries because Stanmore Hospital don't like using them. It makes life a lot more complicated. And so they use only plates and screws on the inside to hold everything together. And so for the other surgeries, she's not had a spica cast, and the recovery has been much easier because, you know, she's been safe to sleep. Because we've been able to lay her on her side. Very important. So if you can get away with not having a spica, trust me, life is easier without a spica cast. So much easier. Also easier to do personal hygiene if your child is in nappies or pads like Elin is. It makes a difference. And a lot of pain meds and a lot of very careful handling for several weeks afterwards. But actually, you know, once the immediate after effects of the surgery were past, she has been really, really tolerant and recovering really well. A bit of morphine straight after surgery, a lot of seizure meds and all of that kind of stuff, but then we've managed on paracetamol and ibuprofen. Now, it might sound weird to you that we've already done all of these surgeries and we're gonna have another surgery because the hip has migrated out again. And I think it's important to know, just because you have the hip surgery, it doesn't mean that you necessarily fix the problem forevermore. What we're looking to do is give her quality of life for as long as she's with us. We don't want her to live with the pain of having a dislocated hip. And there are actually instances where if the child doesn't seem to be bothered by it, then the hospital might decide not to bother doing the surgery, because if they're not in pain, why make them be in pain? And they can still migrate out because the underlying issue with the cerebral palsy, with the undeveloped joint, with the muscles that are firing in the wrong way, all of that is still there, that we can't fix. And this is why, even though they did the surgery on the right, that has now migrated out of socket, and we're going to have to go through yet another surgery. And there's absolutely no guarantee that we're not going to need more. Let's hope we won't need more, okay? We really are looking at keeping her as comfortable as we can and as happy as we can for as long as we can. I suppose the takeaways from all of this would be that yes, it is scary putting your child through surgery, and yes, it sounds very scary, and there's a lot of medical terminology to take in and try and understand when you're in this situation. If you are under a physiotherapist from early on in your child's life and they are doing regular x-rays and physiotherapy checkups, you are in good hands and you will know early. If you're not in that, you can ask for it. If you do have suspicion that your child has developed hip dysplasia because of signs you're seeing of, you know, the legs not moving and bending in the same ways, a leg falling in, a leg being shorter than the other, the child leaning over when they're sitting and showing pain signals, all of those things I said before, you can take them to the child's doctor and you can ask them to investigate, you can ask them for x-ray, and the earlier you catch it, the better. That hip surgery isn't always the best option. Sometimes they leave it, and that hip surgery, while it is a good option, it might not fix it. It might not be, you know, one surgery and we're good forevermore. And I suppose my personal advice would be, if you can get your child to a specialist that really knows how to deal with this, then do that. Her first surgery, and I don't talk a lot about this because it was such an awful experience, her first surgery was done at our local hospital here, and after that I said never again, and I demanded that she would be referred to the Royal National Orthopaedic Hospital. And we are very happy with our surgeon there, aren't we? And the whole team there. Yeah, we are. So as always, you know, remember to advocate for your child, remember to advocate for yourself, remember that as the parent you always know best, and remember that I will always be here and share what we're going through, and hopefully that will be helpful for you and make you feel that you've got somebody in your corner. You know, I've done this a few times, I'm feeling rather seasoned, I'm a pro at all of this, and we're here for you. So hit that subscribe button if you haven't already. Share your story with us in the comments, And we will see you again very, very soon. And we're gonna say mwah.